So I had struggled for years with my horrible skin, hating myself, feeling depressed, feeling embarrassed. I was doing everything I could and nothing was working. Why wasn't it working? Because it was the wrong advice. What happened one day, I was walking through Selfridges in London. A lady from the Clinique counter that just started this Clinique makeup asked if she could examine my skin. I was really embarrassed, but she had this kind of beginning of a computer. It was actually just like little things she put across a board, and then she from that was able to say, you need this very delicate cleanser, toner, moisturizer. And these three lotions go on your skin one after the other. And you don't want to use soap. You don't want to be vigorously doing any of that, because you're irritating your skin without the moisturizer, without the right chemistry. And I was all about chemistry. So off I went, pH balancing, doing these three. It took a week. It was a week. And my skin was like beautiful. Everything cleared up. And, that was so shocking after years of feeling so helpless, so irritated, so in so much pain and suffering, that when I heard dentists telling people to brush and floss, if it's the wrong advice and it's not working, we have to find a better way. And here was my mother. She brushed her teeth. She was a clean, healthy individual. I remember her foaming up all this toothpaste, and it wasn't that she didn't care about her teeth, or she was lazy, or she was dirty, or anything. And this so resonated with me that what she was doing wasn't adequate. I had to find a deep cleanser. I had to find a toner. I had to find a moisturizer for her mouth. And the first actual product in my complete mouth care system is something called Closis in America. It's Ultradex in Canada and the UK. And at the time when I started this, it's like a deep cleanser. We were using it as dentists before patients' treatment appointments to try and get rid of the bacteria that might spray into the air. Now, this we're talking about a long, long time ago. This has now become a thing in America, finally, where people go for a dental appointment and they will rinse their mouth before they start with some kind of mouthwash. If I were you, I would take Closest with me, because this doesn't damage the bacteria of your mouth. What it does is it interacts with the saliva in your mouth to form oxygen. And it is the oxygen that cleans your mouth. It oxygenates, depresses the anaerobic bacteria. It helps the good ones. It's a wonderful, deep cleanser. And that was what is the first stage of my complete mouth care system. The toothpaste was the toothpaste. They had just in the 60s actually done randomized clinical trials, something that's never been done with any other toothpaste, to show that it actually could reverse a cavity. It could heal a cavity before it started. It's the old $1.96 Crest. It's made with silica. Silica helps your teeth to mineralize themselves. It's made with some very specific fluoride. I am very specific about the fluoride that I recommend and the dilution of it, and that it has no glycerin. And, this is why this toothpaste was the brushing part of my complete mouth care system. The Listerine is, again, much maligned. Most of the products I recommend are much maligned. People think that this is a terrible product. It's actually essential oils. Most people are shocked to find out that the active ingredient is not alcohol. It's nothing like strong enough to do anything in the mouth. It's also not able to sterilize your mouth. If you use an alcohol wipe on your hands, you have to wipe it until your hands are dry. And it tells you not to use if your hands are dirty or slimy. Well, your mouth is dirty and slimy, let me tell you that. So this is the reason this works, is because it contains thymol and menthol. And thymol and menthol are two essential oils when you use them in this incredibly dilute. That's the reason for the alcohol, is how it gets the essential oils into solution. Yes, I wish it wasn't blue, and I wish a lot of things about it, but it's amazing because it's like a toner. it really does clean up the surfaces of the teeth so that they can repair, remineralize. And the other thing in Listerine is there's eucalyptus, and eucalyptus is actually really healing to regrow your gums around your teeth, tighten them up. And the final part of the system is kind of like the moisturizer, back to that skin analogy. And this is the ACT. The ACT is a dilute 0.05 sodium fluoride, no glycerin, mouthwash. The new bottle is a little bit different, but there's no alcohol in this. So this is your moisturizer. You see, you got to understand that each product separately would behave very differently. When you put something into a system, I mean, anyone who knows about skin would never just dab astringent toner on their skin and just say there, especially if you live in a dry climate, your skin would dry up like a prune. You have to use these things in a sequence. It was the synergy of each product working together. And I saw that with my skin. And that was how I developed the system. And my mother started using it. And, we started perfecting it. I figured out different things along the way, like the better toothbrushes to use and the fact that your sinus health is included in this whole biofilm of your mouth and your nose. I found out how to acquire xylitol and add that into the program. And all of this works together. That's the incredible thing. And when you use this whole program as a unit, well, my mother lived to be 95. She lived 50 more years with minimal dental treatment. I think she had a couple of cleanings along the way. I think she had a couple of fillings that fell out here and there that she had replaced. But I mean, her teeth, from having to have full dentures at 45 to living to 95 with the same number of teeth as she had at 45. Tell me about that one with minimal treatment. So, I started then suggesting this to my patients in my dental practice as I went along. I added to it because I worked in Switzerland and learned a lot about nutrition, timing of eating and drinking. These are all the things that I teach people about. Gum massage to get your gums to actually regrow. And the use of xylitol, I've perfected that along the way so that you have a kind of foolproof system. Now, you may not like one or other of these products. Listerine, isn't it? If you don't want to do it, you don't want to do it. But I'll tell you, nobody talks about the toxicity of fillings. I know they talk about silver toxicity, but what about the plastics in your mouth? What about blocking up the grooves where healthy bacteria is supposed to live with fillings in the first place? What about dental cleanings? They're stripping off the biofilm of your teeth. Do we want to do that? I don't think anyone's really looked at that scientifically. Do you take an antibiotic every 6 months to kill off all the bacteria in your gut to try and stay healthy? No, we know that's not the way. You every day try to nurture the good bacteria in your mouth so that you don't need an antibiotic. You're so resilient. It takes care of you. And that's my philosophy with your mouth. And you mentioned that I don't talk about flossing. I've never needed to. I didn't until I came to America and everybody's floss, floss, floss. And I'm like, really? What I had seen was that women in particular who are so much more compliant than men generally, I think, when they're told to do this stuff, they floss like crazy. And they have more gum recession and more sensitivity and more damage to their gums because they're given the wrong advice. It's kind of like me scrubbing my face. That wasn't the way. I created grooves and cuts and bleeding and treat it so that you get a healthy biofilm. There's no infection. And you won't have plaque. You won't have any plaque. There won't be any stuff stuck between your teeth if your gums are there. Now, if you're coming at this in a very late stage where you've got huge gaps because your gums have disappeared, you may have to floss to get some of that. Or if you've got a lot of fillings, because the fillings themselves create these places where food gets stuck. They got little ledges, or you got a crown that's the wrong shape. Or once you start having dental treatment, you're at much more risk of needing more dental treatment because you're at more risk of food getting stuck and things going wrong. Perfect teeth are worth hanging on to. That's why I teach people to reverse cavities so they don't need a filling. It's so valuable to have perfect teeth and hang on to them for your life. So that's the story. It's long, but it explains how I came about my system and why my system works.